Dr. Martinez, I want to speak about the Defense Health Agency. When it was founded a few years back, one concern that we heard is that services might pull back staffing from joint medical billets if they perceived higher needs in their own commands. This was enough of a concern for the committee that in the most recent NDAA, we passed a provision that required the services to maintain 85% of the manning requirements from the 2016 Joint Table of Distribution at joint hospital and clinic settings. I'm concerned that what we heard at the time when the DHA was founded, it may be coming to pass. I know you've been out for a few years. As you prepared for the hearing, prepared to take on this responsibility, is this a concern you've heard that services may be pulling back somewhat from these joint medical billets to make sure their own facilities are fully staffed?
Senator, as I'm coming in, the number one issue I'm concerned about is the readiness of the force. So if I'm confirmed, I'll work with the team to understand better your question, the particulars of decrements or plus-ups, whatever is required. But the litmus test must be, are we going to create an environment that encourages readiness? So, or are we taking away from that? If the answer is we're taking away from that, we have to relook. If the answer is we're going in the right direction, I'll reinforce that issue. So if confirmed, again, I commit that will be my driving force, and I hope that I can bring positive change to the military health system.
Well, thank you. I'll look forward to working with you on that. Like I said, I know you've been out for a while, so I don't expect you to have all the details ready at your fingertips. Maybe after you've been on the job, after confirmation in 30 days, we can talk about where manning stands at all the joint medical facilities, and especially at the Crown Jewel at Walter Reed up the road.
Senator, it would be my honor.
Another issue that I've heard some concerns about in recent years is the amount of time it takes to authorize military health care for all government employees who are experiencing symptoms from what's become called anomalous health incidents, also known as the Havana syndrome. This is not a question or a concern about the source of so-called Havana syndrome symptoms or who may or may not be responsible for them. I know that's been in the media a lot lately. This is simply about those people who are experiencing these symptoms and making sure that they get timely care. Again, we were concerned enough about it on this committee that in the most recent NDAA, we directed the Secretary of Defense to provide timely access for an assessment subject to space availability at the National Intrepid Center or any other appropriate military medical treatment facility, and to furnish that care to all U.S. government employees and their family members who may experience these symptoms. If confirmed, can you ensure that government employees and their family members who experience anomalous health incident symptoms can get timely access to evaluation and treatment at a military hospital or at the National Intrepid Center?
Senator, I'll work with the other departments and agencies, and yes, I'll work hard to streamline the access to those that require them.
Thank you. I think it's really important. Obviously, these incidents are centered mostly around our embassies where we do have uniformed service members as defense attachés or other positions, but Americans who are serving those positions, whether they're at state or another government agency, also need the benefit of the expertise I think that the military brings to bear. Mr. Lowman, question for you. I've recently introduced bipartisan legislation with Senator Kelly called the Reshore Act that would secure the supply chain for rare earth elements and several other critical minerals. It's recently come to my attention that the Defense Logistic Agency's National Defense Stockpile has been dangerously underfunded for years. I'm greatly concerned that we rely too heavily on Chinese processing facilities to refine the raw materials necessary for our systems. If confirmed, can you commit to me to making sure that the National Defense Stockpile's budget and authorization requests match the requirements that are set forth by law?
Senator, there will be no greater advocate in the department for the necessary materials and the resources needed, one, to sustain readiness, but two, to mitigate and build resiliency within our national defense supply chains.
Thank you. I appreciate it. I just want to stress that, again, this is a solvable problem. The irony about rare earth elements is that they are anything but rare. You could probably go out on the National Mall and dig up most of them. What is rare is the actual mining and the manufacturing processing of it, which we've foolishly outsourced to China over recent decades, and that it's vital that we get that production out of China back into the United States and also encourage our partners to produce those minerals and refine them as well. Thank you.